Hello and welcome back to my channel. My name's Kris, I'm an Australian GP, and one of the most common things we do in general practice is check your blood pressure. But why do we do it? What does it tell you? What actually is blood pressure? If you've ever thought about these questions and haven't ever found the answers, this is the video for you. So let's deep dive into what is blood pressure and why do we care so much? Blood pressure, as the name suggests, is the pressure at which your heart has to pump to circulate the blood around your body. There are two measurements taken when we take your blood pressure, a systolic, which is the top number, and a diastolic, which is the bottom number. The systolic pressures reflect how much the heart actually has to pump to get blood to circulate through the system. And a diastolic pressure is how much the heart has to relax to fill up with blood again. So it's like opening and closing. So how much pressure does it take for the heart to open and fill up with enough blood to pump around? And how much pressure does it take to close that and have it shoot off and around the body? Blood pressure itself is measured in millimeters of mercury, which is written as mmHg, the H being the capital. We just say the numbers more often than not. We don't say, 120 millimeters of mercury over 80 millimeters. Yeah, no, it's just 120 on 80. And that's the thing, we talk about it on systolic, on or over diastolic, because it's a ratio, that's the pressure. The average blood pressure for the average adult person is about 120 to 129 systolic and 80 to 89 diastolic. Mind you, there is a lot of variability and someone can be very healthy with a blood pressure of 132 systolic or maybe 74 diastolic, or you might have a lower systolic pressure of like 110. So that's why I say the average blood pressure for the average human. It varies a lot depending on age, comorbidities, if you're athletic or not, your family history. So, average is a very strong word, but we aim for about 120 on 80. That's textbook. Blood pressure, if it's not normal, can be too high, and this is known as hypertension, or can be too low, known as hypotension. If blood pressure is too high, you risk damaging the arteries in the body, so the blood vessels, which makes them lose their elasticity. So we don't have steel pipes in our bodies, we have elastic kind of like balloons. We want things to be able to expand and contract and vary depending on the various pressures on the body. If you had a quick rise in blood pressure because you were running away from something that threatens you and your blood vessels didn't have that elasticity to expand, you can imagine there's going to be issues. When we lose that elasticity, which is a very hard word for me to say apparently, you narrow the blood vessels. So you have pressure, which is pumping from the heart, but you may have to increase that pressure to get through a more narrow structure. Think about the pressure it takes when you're drinking something through like a boba straw, so quite a round diameter. It doesn't take much pressure to get a lot of water in your mouth or tea or whatever it is. But if you're drinking through a popper straw, so tiny little diameter, you got to work a lot harder. Think about that, but the inverse, just pushing out. It takes a lot more pressure if the diameter of what you're working with is reduced. So that's why high blood pressure can damage blood vessels and their elasticity, which narrows them, which further increases blood pressure, and it's a big cyclical disaster. When we have these really strict, narrow blood vessels, you risk having them rupture, and you have a risk of them leaking as well. Having high blood pressure causes a myriad of different issues, including kidney disease, liver disease, eye problems, heart attacks, strokes, and dementia, to name a few biggies. If you have hypotension or low blood pressure, you may not have enough blood circulating to give enough oxygen, which is one of the whole points of blood circulating, is to bind oxygen to red blood cells, to carry them around, to oxygenate the tissues, and therefore you may have symptoms because of that. The causes of blood pressure variations are numerous. So for high blood pressure, we talk about it as a primary or a secondary cause. You were just born that way, or there is a reason for it. The same can be said for hypotension, though there are more causes of a secondary nature, including, and I'm going to read the list, postural, postprandial, so after you eat, nervous system damage, so your body isn't able to regulate and you sit lower, and neurally mediated hypertension, so more to do with the nervous system again. So let's talk about secondary causes of hyperblood pressure or high blood pressure. We have type 2 diabetes, family history, high cholesterol, known as hyperlipidemia or hypercholesterolemia, obstructive sleep apnea, chronic kidney disease, adrenal gland tumors, thyroid disorders, some medications. This includes the estrogen-containing contraceptive pill, some decongestants, and some anti-inflammatories. Illegal substances like amphetamines, smoking, having a diet high in fats and salts, high alcohol intake, and stress. As for secondary causes of hypotension, so low blood pressure, there is dehydration, eating disorders, pregnancy, having a low heart rate known as bradycardia, Addison's disease, so having a lack of cortisol, parathyroid disease, blood loss, sepsis, anaphylaxis, and some medications, including diuretics, some beta blockers or heart medications, some antidepressants, and a whole host of anti-hypertension drugs. Both hyper and hypotension may be asymptomatic. That is, you don't know you have it until we measure it. And that's why we care so much, is people don't usually come in and say, look, doc, I've got all these symptoms, I think it's my blood pressure. Sometimes they do, and sometimes you're right. But more often than not, we pick it up just by screening. And taking blood pressure is so easy. It is putting your arm in a cuff, and now in 2022, the majority of them are automatic. So we press a button, it pumps up, and then it spits out a number. Some of us still have to do manual blood pressures, so if you're learning that in medical school or you see someone doing that, it is still very valid. And there are some conditions where a manual blood pressure is actually the gold standard, not an automatic one, including in pregnancy, in some heart arrhythmias, and a couple of other things, but that's not the point of this video, and I could be here forever. So the symptoms of having high blood pressure, again, it's often silent until it's way too high, but they can include headaches, nosebleeds, and feeling really short of breath. As for having low blood pressure, the most common symptoms are feeling dizzy or unsteady, nauseous, shaky, sweaty in the hands, blurred or fading vision, nausea, fatigue, a lack of concentration, and having a high heart rate to try and compensate. So how do we investigate blood pressure? Well, I've already alluded to, we can test it in a GP setting, but one reading doesn't give us an answer. To get an accurate reading of your blood pressure, you should actually do 3 in a row, take the average of the second 2. Something I didn't mention before is people can have what's known as white coat hypertension, which is their blood pressure is high in medical settings and medical settings only. People used to think it was because of the white coats that doctors stereotypically wear, makes people nervous. We don't wear the coats anymore, but it's still called white coat hypertension. And it's not that that person's scared of the doctor. It just happens. So to determine if the reading is true and to determine the severity, we can sometimes ask people to wear a blood pressure monitor for 24, 48 hours or even longer sometimes. This will take random measurements at various intervals during the day and the night to see what your average daytime, nighttime blood pressure is, and if there is a response to certain activities. And you also get to press a button to say, I'm having a symptom right now, and it'll correlate and tell us what your blood pressure was at that time. Because blood pressure is related to the heart, we can also image the heart with a chest x-ray or an echocardiogram or an ultrasound of the heart. And because there's a lot of secondary causes of both hyper and hypotension, quite often a blood test will be done for both, looking at things like the liver and the kidneys and the thyroid and your electrolytes and your iron and lots of other things. As for treating it, for hypertension, the aim is to reduce, because if you've got high blood pressure, like I said, it causes a long list of sequelae. So we might give you anti-hypertensive medications. And there's a couple of different classes: ACE inhibitors, beta blockers, calcium channel blockers, diuretics. There's quite a few. It really depends on you, your age, the severity of your condition or your disease, your comorbidities, your allergies, everything else as to what we choose. But the most common initial medication is an ACE inhibitor or an ARB. We will also talk to you about lifestyle management. If you're a smoker, can you stop? And I say can you stop, not in a can you do it, is some people will need a lot of help doing that. So how can we help you? Can you reduce your alcohol intake? Can you be more active? Get your cardiovascular fitness up, go for a walk, do something more physical during the day. Are you able to lose weight some way? And sometimes doing those other lifestyle things can impact that. Can we change your diet, reduce the salt, reduce the saturated fats, increases in the good nutritious foods like high fiber fruits and vegetables? Can we reduce your stress? Do we need to address your mental health? So it's not just take a pill and go. There's a lot of lifestyle stuff that we do. Hypotension is often managed just conservatively, as in no medications. So telling you, look, you've got lower blood pressure. Let's make sure you're slower when you get up so you don't have a big drop if you've got orthostatic blood pressure drops. Can we give you compression stockings to decrease the pooling of the blood? Can we do those sorts of things? Sometimes we may tell you to increase your fluids. Sometimes we may tell you to increase your salt intake, and this is to try and raise the blood pressure. So that's blood pressure 101. There's highs, there's lows, there's some signs, there's some symptoms, there's a lot of issues from having especially true high blood pressure, and there's a lot of different ways we treat it. If you are concerned about your own blood pressure, please do go and chat to your GP. And if there's any other basic topics you want me to cover, like very soon I'm doing a video on asthma, so stay tuned, then let me know. Otherwise, like, subscribe, comment, all the YouTubey stuff. I hope that you are doing well. And until next time, guys, stay safe, stay healthy, and I'll see you in a video very soon. Bye-bye.